Typically, orthopedic surgery has at least 8 weeks where your animal will need to be strictly rested. You cannot give up in the middle of this. This is a long game for your pet to have success. I strongly urge you to put your pet in a crate. So instead of a gate or a small area where they can escape or jump over, you know that you have a roof and great boundaries where your pet is not going to injure himself or herself. If your pet is one of the very few patients that really does not tolerate a crate and it's going to be dangerous to put your pet in that crate, then I do want you to confine your pet to a small area in your house where there's good traction. You have to restrict your pet the entire recovery period from jumping on furniture, having access to stairs in the house, running to the Amazon Prime guy in the front door, slipping and sliding where that no traction hardwood floor, running, jumping, roughhousing with pets or humans during this recovery period. We do want your pet to use the leg. I would like you to use a short leash, like a 4-foot leash. No retractable leashes for this recovery, okay? Get rid of those for this short term. And when you're outside for the first 2 weeks, we're talking 5 minutes, slowly down steps if you have them, just in and out of the house to go to the bathroom and come back. After that first 2-week recovery period, once the incision and surgical site is healed, we want to amp it up a little bit. So you're going to start with 10 to 15-minute leash walks. Over a time frame, we're going to have you build up 30-minute sessions 3 times a day. This is not your starting point though, this is your ending point. The number one word that I want you to remember is control. When you lose control of your pet, that puts too much stress on the surgical site. If there's metal or sutures holding something in place, those things can break with too much activity. So adhering to the instructions we give you is extremely important to have a successful outcome for your pet.